How many of you have heard of the Nairobi Declaration? Probably not too many. I kind of suspected those who raised their hands. So that's good. A lot of you haven't heard about this. It's actually something we've been working on for the past year or so, and it's actually gained a lot of momentum in the past few months, which is really an exciting thing that I can talk a little bit more. So CCIH started working with this group, the German pronunciation I won't even try right now, but it's the German Foundation for World Population and an Indonesian organization called Muhammadiyah, which was an interesting combination of organizations, and actually was brought about by, I think someone at Gates brought us all together. So back in June, about a year ago, Henry Mosley and Ray and Douglas, and I'm not sure who else in the room, went to this consultation in Nairobi, and they came up with this interfaith statement. And we've been working since then to get more members, and at Muhammadiyah as well, trying to get people to sign on to it. And I'm not going to read the whole thing, but I thought it was important just to put that out there. I'll just read the parts in bold for now, but you guys can access that. I think the PowerPoint will be available later, so you guys can access the whole thing. But the beginning is, we, the leaders of religious institutions and faith-based organizations, believe that health is a universal value held by all faiths and a universal right for human beings. And then at the end, I'll just get to that. It says, in this declaration, we commit to leveraging our networks to support family health by providing education and services that enable families to plan the timing and spacing of their pregnancies consistent with their faith. So if you haven't heard CCIH say this before, we're not prescriptive about what people should be doing. We're just trying to give people access to the education and the materials so that they can make their own decisions. We don't feel like that's a decision we should be making. So consistent with their faith, they can decide what methods they want to use, and we avoid the controversy of abortion and a lot of those other things that people want to argue about. So we stay very neutral in that way and have been successful. These are some of the sign-ons. There's over 200, so I just cut and pasted a few of them that from the beginning. So the Christian Health Association of Kenya is involved, the African Christian Health Association platform, the New Evangelical Partnership for the Common Good, which I think is headed up by Richard Cizik, Henry Mosley, Bill and Melinda Gates, the Packard Foundation, USAID, the World Faith Development Dialogue, amongst others. Here's a couple of other members of CCIH that I highlighted that have also signed on. So if you haven't been called about it, I didn't call every member, but if you'd like to learn more about it and how you can sign on to it, please get in touch with me. I have business cards, and I'd like to share more with you about that, the Nairobi Declaration. Something I mentioned briefly earlier is just this Reproductive Health Supplies Coalition. We got involved through the grant through the Institute for Reproductive Health. They encouraged us to join this coalition, so we just became the first faith-based member a few months ago, and I think they were very excited about that. I think they have over 200 members. I can't say for sure, but they were excited about getting a faith-based group. I think there might be one since then that has joined, but and they certainly welcome all of you. We don't have to be representative of our members, so they would love for more of the Christian organizations to join. It's a free network. They have these different working groups. I'm not going to read all of their objectives, but if you get involved with it, I was trying to tell someone about it, there are opportunities for funding, and you have to be a member to get the funding opportunities. So it's great to just be a part of it. You can decide how involved you want to be with it. You don't have to commit. You can join a working group and get as involved as you'd like to be, but for the funding opportunities, you have to be a member. So it's good just to sign on and help support, because they really need, which I'll talk about later, they really need the faith-based voice to be heard. So I don't think it hasn't been heard enough in the past, so we would definitely increase that. Also, these are some additional groups that I know IRH has been involved with this caucus for new and underutilized reproductive health technologies, and a guide will be coming out that they've developed about that. And then the Latin America and Francophone caucuses, or they're called caucuses. So those, I think, are going to be becoming more prominent in the coalition. And as Lauren said, I probably don't need to repeat it, but if you don't have the product, you don't have the program. So you can, I think this woman mentioned it, you might not have, I don't know if it was in the short video, but actually I think it's in the longer one, where she says she has all the training to do the family planning but wasn't getting the supplies she needed. So she was very frustrated that all that training was going to waste, and she wasn't able to provide the services that women wanted. So obviously that's a big thing that we need to work on, getting the supplies getting them strengthened, getting them out to the field. Another group that we have joined, and I'm not terribly involved with this group because it's very specific to what's happening in the field, and I don't consider myself a logistician, is this group. So if you know others in your organizations that are logisticians working in public health, this group is very active online. They send so many emails out about what's going on, very specific questions and answers. I don't think I've ever seen a group so interactive. So if you know people that would benefit from that, it's an online, it's a free network. I don't know if I think somehow JSI, John Snow, has something to do with organizing that, but that's a great group to get involved with. And I have about 10 copies of something we've been developing actually with JSI, and I'd like to get this out to people that are working in the field that really could get it out to people for feedback. So I only have 10 copies. Unfortunately, it was not exactly cheap to print off, so I just, we'll be having that online next week. But for those of you that really think somebody could benefit from it, I can give you a hard copy. We'd like to get feedback on that. It's sort of a draft first edition, so please take a copy of that.
Where will it be online?
We have a knowledge bank. So you go to the knowledge bank under family planning, under probably CCIH publications, because we were involved with it. So getting back to some of the strategies for the reproductive health supply security, these are two tools that you can use: the reproductive health interchange, which gives you access to all the contraceptives going in and out of countries or going into the countries. It may not be totally complete, but it's pretty thorough about what's going on in these 140 countries. Access RH taps into the RH interchange, and it enables people to get access to these to the commodities they need. Though I haven't talked to anyone who has used it, so it would be good to find out if it works well. I know it's sometimes we hear of the challenges people have on that, so definitely check out that and see if that's something that your organization can benefit from. And more we've just been hearing as we talk to people from different places, especially USAID, they're really stressing how important it is for the faith-based groups to show up at the meetings in country, to go and meet the mission, the public health officer. I'm not sure exactly if that's the name, but the person in country. I know they're very hard to reach, and sometimes people are discouraged by the feedback or the lack of interest, but I think we have to be persistent and get people that you're working in countries to show up, go to these meetings. They need to see us. They need to hear our voice. I don't think it's been represented as well as it could be. We actually have the list of all the contacts, so if you don't know how to contact someone in a country, we have some of the email addresses to get in touch with those people. So it's good just to start showing up in meetings no matter what you know. I think they're not looking for people to be experts in this. They just want you to show up and contribute and start learning, just like we do here at CCIH. So don't hesitate to encourage people you know that are working in the field to do that. And this is another grant that we just started a few months ago it's a USAID grant being managed by World Learning, and these are some of the objectives of that grant. We're providing support, technical support to our members, to both members and the ones that are the grantees, which are listed at the bottom, which are both secular and faith-based groups. We're facilitating meetings and communications between everyone. So we had a meeting on Friday morning with the group to kind of get an update of what's going on. We're translating some key documents. We've only translated a few so far, but we'd like to do more. We'd like your feedback about what you feel like would be the most helpful. I mean, we have limited funds, but we want to translate the most useful documents. And Douglas just updated our mechanisms of action document, so we'll be translating that pretty soon. Just say. 1 minute. Oh, 1 minute. Okay. So that'll be a good document to get translated into French and Swahili, at least for now, because it's a great reference document for people that are working in the field. And we're organizing meetings, or organizing the webinars. We'll hope to have a webinar in a few, maybe next month, on this, basically on this guide that we've been working on with JSI. And everyone has been hearing the buzzword integration these days, so we're really trying to find out what's going on with integration, what are best practices, how to go about it, and trying to keep up on the documents, the meetings that are occurring. There's an integration, a reproductive health and HIV integration conference that's next month, or not next month, in September in Nairobi, so keeping our members informed of these opportunities to learn more about integration with all these different things, something we've been a part of. And lastly, I'll just say Ray has been invited to the summit, our fearless leader there in the middle. There's a family planning summit next month, and Ray will be representing us, so that's exciting. Please be praying for Ray around July 11th, and we're hoping to have some meetings while he's in London. So we're very honored that he was invited because it's actually a very high-level meeting with heads of state from all over the world, just maybe like 200 or something. So the fact that Ray's been invited to offer the Christian voice is pretty exciting for us. So we're hoping to get a few other people invited to it from the faith-based community so that we can have the voice. We can share the Nairobi Declaration. We're not sure if that's all going to happen, but we're working on that. So I think that's the last slide. There's my email address. I have business cards. I'd love to interact with all of you, if not today, throughout maybe at Advocacy Day for those of you that are going to be here, and then obviously through email and Skype and all that. So please don't hesitate to get in touch and learn more about what we're doing and how we can help support you. Thank you.
Thank you very much. Great. Would you just go back one slide? I noticed that the halo actually belongs over Ray's head, but he's very generous, so he's shared it partially with Rajiv Shah, the administrator for USAID.
I thought about that too, actually.
A couple of questions for clarification or technical points. Thanks, Amy. Now I know why we're tired. Yes.
Yeah, thank you so much, Amy, for that wonderful presentation. My name is Lily, and I work for Compassion International. My question is on the methods, the products, and I know you supply resources, but I'm wondering for areas where there might likely be very hard to get the products, the family planning products, do you teach them on how to make the cycle beads? Because that's something that can be made locally. They don't have to wait for some shipment from overseas or from some place. They can make that. Do you train them on how to make those cycle beads?
It's not exactly encouraged. Lauren might be able to answer that better than I could. We can't stop people from doing it, but there's reasons why it's better to get them. Lauren, do you want to talk about that?
Sure, yeah.
Had to answer
some
that
of the
question
issues
more.
that we've had to deal with are around quality control, and while some women do, in very rural areas, do make them on their own, which is fine. It would be illegal for them to then sell them, but they could make them. But the issue is that the method relies so much on counting the exact number of colored beads in that string that if there was just one color off, it would discredit the efficacy of the method. So yeah, we strongly discourage against that. But there are some options that are paper-based that could be more easily distributed.
And paper is pretty easily replicated also.
Just adding into that, I had discussions with ladies in Malawi about all the different methods, and I was amazed that the women who I was talking to who had secondary education did not know anything at all about the rhythm method. And I was explaining it to them and explaining how it worked and how they have to have a regular cycle. And they came up with the idea of actually you have two different boxes and you can even use pebbles, and you can then even decide, you can actually do it for somebody who has something other than a 28-day cycle, and if they have variable cycles they can actually do even, but it does take a lot of education and a lot of understanding, obviously.
Sure.
But that's what they themselves came up with.
Yeah, this is actually great, and I want to build on it. We have another fertility awareness-based method called 2-day method, which relies more on cervical secretions, so it's easily accessible to women who do not have regular cycles, and it uses some of those very same ideas to keep track of when they're sensing their secretions and to use things like putting objects in a bag or a box. And I have resources for people who might be interested in that.